Good evening, everybody. Thank you for joining us this evening. We're live on Facebook and YouTube, the Council's YouTube channel. If you're watching on Facebook, you can submit a question to the panel by commenting below. And if you're watching on YouTube, you can comment your questions in the live chat. So the Q&A tonight will be around an hour long and we'll wrap up around 8 o'clock. We've got a fantastic panel who I'll introduce in a second. So as I say, you can submit your questions in the comments below to the panel and have them answered live. We are aware that there's a lot of interest in tonight's Facebook Live. We will be taking all the questions that are asked tonight, whether we're able to answer them live or not. And we will be putting them into a frequently asked questions document that will be put up on the council website. The questions this evening will be focusing on the return to schools and childcare settings. Fortunately, we won't be able to answer questions about anything else. And we also won't be able to answer questions relating to individual schools or individual childcare settings as well. And the session will also be available to watch on replay once we're offline. And do please, if you're watching on Facebook, click share to share to your live stream so that your family and friends can see what we're talking about as well. So with no further ado, we will introduce ourselves. So I'm Deborah Harkins, I'm Director of Public Health at Calderdale, and I'm going to introduce my fellow panellists. So we'll start with Lesley.
Good evening, everyone. I'm Lesley Bowyer. I'm the Senior School Effectiveness Officer, and I lead the team for schools in Calderdale and also the team for early years. We could only have 4 people on the panel tonight, so we don't have anyone from the early years team here, but I'm representing them and they're contributing behind the scenes as well.
Thanks very much. Gugsy, introduce yourself.
Hi everyone, my name's Gugsy Ahmed. I'm head teacher of Parkinson Lane Community Primary School.
And then Jan, introduce yourself as well.
Oh, hi, my name's Ghee. I'm Operational Manager for Children's Services for Locala in Calderdale, and that includes health visiting and school nursing. Pleased to meet you all.
Great, thanks. So we're going to kick off with the first question. We know that the council, partners, schools, our NHS colleagues are working hard to support schools get ready
So it appears that we've lost Debs there already. I think she's going to come in with the first question, and that's how's the council working with Calderdale schools to make sure pupils return to school as safely as possible. So Lesley, if I can go to you first, please.
Yeah, thanks, Gugsy. This is a really key point. I think that since lockdown first started in March, there's been an awful lot of partnership working. I think it's been obviously an unprecedented time for all of us. A lot of learning's taken place, but it's been crucial that all services and schools, early years settings have all worked together on this. So there's been a number of things going on. We've had a safe education hub, which involves representatives from early years settings, schools, including primary, secondary and special schools, Calderdale College, transport, public health, special needs, the whole remit really, that's met regularly so that we can discuss the issues that people are facing and find solutions for those, and that's been a key group that's met regularly. We've also had a regular briefing that's gone out, because we realised in the very first week just how much information was coming out in really rapid succession and regular updates. Within the council, we've pulled that together into what was a daily briefing, but then became twice a week, to just try and make sure that people weren't missing any of the key information with the volume that was coming out, but also that we could summarise it in one easy to access place. And that goes to all early years providers and to all schools and the college as well, and other services. The directors held meetings with representatives from different sectors, again, to hear their views and to make sure that we can respond to the concerns that there are. And we've had regular meetings, particularly for groups like our special schools and the early years teams, so public health, the early years childcare and sufficiency teams, and special needs portage service, because we recognised that there were some really vulnerable groups across the sectors. So we've had regular meetings, weekly meetings with them. We've also obviously worked really closely with colleagues in health and safety, public health and HR to provide up-to-date advice. And they've helped with risk assessments for settings and just providing really clear advice. And, you know, I can't thank those colleagues enough, but especially public health. They've responded to, you know, countless queries that we get from parents and from settings to make sure that we're giving really clear and up-to-date advice.
Jan, do you want to go in there?
Oh.
Sorry.
Yeah, so the school nursing team and the health visiting team have worked with the local authority, in particular the public health teams, to make sure that, as Lesley just said, that we give clear and consistent and up-to-date messages. And with the other thing that we've been very conscious to do is to make sure that families are aware of what's available for them to support them around the return to school, so that they can contact Healthy Future School Nursing Team and the health visitors should they need that additional support and have got queries about either their own or their child's well-being. So we've been making sure that we've got those messages out so that families know where they can go should they need additional support at this, you know, often confusing time. Okay.
Gugsy, tell us about what you've been doing in your school.
I think really, if I look at it from a school's perspective, I think one of the things that's been really, really useful is the partnership within the cluster groups. Each of your schools are going to be based in cluster groups, normally geographically based, but certainly we're based with the Todmorden group, and the sort of collegiality there between head teachers and schools has been second to none. Really, you know, running ideas past each other. The briefings have been really good from the local authority. I think something very, very good from Calderdale with the health and safety team. They were exceptional, paid visits to schools, certainly helped with the risk assessments. Public health have had a line to them, so we can speak to some of their advisors if we're unsure about anything. And I think more than that, a lot of schools, certainly this next week, will be having inset days where they're actually coming together as a staff to really look at the nitty-gritty in terms of bringing children back into school in a safe, concise way.
Brilliant, thank you. Thanks, everybody. I'm just looking through the questions here, and there's a question, Gugsy, actually, about whether COVID will be likely to affect future exams like it has this year. For example, the 11 plus. Are you able to comment on that?
I think we're probably it's sort of a case of looking into a crystal ball there, whether it affects future exams or not. And I think that's something that we're going to have to take at the time, and depending on what happens with the pandemic and you know with the 11 plus and what the grammar schools decide, and certainly with SATs and you know year 2 tests, etc., the year 4 multiplication tests and GCSEs. I think if the exams this year are anything to go by, I think the government will want to do things differently.
Can I come in, Deb?
Yeah,
there has been some sort of updates on that, and certainly at the moment the government's working towards there being the assessments that would normally take place next year. So plans are sort of continuing with that. So arrangements for moderation of SATs, for example, in primary schools are proceeding at the moment, but obviously that's going to be kept under close review. and Ofqual, who've obviously been in the media for obvious reasons over the last couple of weeks. They've undertaken a consultation that's now closed, and they've produced some the outcomes of that. And there will be some adjustments planned for GCSEs and other exams next year. One of the things that's being discussed is perhaps a change to the timetable. That was consulted on, but as of today, when I last looked at that feedback, there hadn't been a decision made, but it's possible that the exams at secondary school may move to later in, so probably instead of sort of May, June, it could be June, July, and that would give that extra time to recover the lost learning, some of the lost learning time that there's been this year.
Thank you.
That may address. Sorry, Debs. That might address some of the issues at primary school. Certainly with communities such as ours, where Eid's going to fall within SATS week this year. So I know they're looking at the flexibility there as well.
Great. There's a question here that I can see that says, can we shed some light on the rumours about schools isolating children that have COVID symptoms without parental consent? I don't know if anyone wants to comment on that.
Yeah,
I can see.
I'll come in if you want there. This isn't a Calderdale issue. This is, you know, we've been speaking with colleagues in other local authorities, and there's a lot of rumour and speculation on social media about this, and it's linked to the COVID Act that does make some scope for powers for testing and isolation and so on, but that's not in relation to schools. And I think it's really important to stress this. Schools do not have the power to detain children. If a child became ill with symptoms at school, the family would be contacted and would be asked to collect the child. I think one of the rumours on social media is that the child wouldn't be sent home, the school would keep them. Well, that isn't the case. Our schools don't have facilities to do that. So children would be sent home. It's in everybody's interests, and the procedures would be followed there for testing and tracing. So that's one of the issues. And another one then is that if a child tested positive, they would be taken away from the family. That's certainly not the case. The child would be with the family, and there are very clear procedures to be followed there. So I think that's important that we clarify all that. Schools do not have powers and will not be taking children away from families.
Does anyone else want to comment on that, Gugsy? Do you want to come in?
Yeah, can I just a couple of things on that. First of all, it's probably worth outlining what most schools are considering doing when a child's suspected of having COVID. We've got to remember this is a responsibility for all of us in terms of parents looking for symptoms, etc. But should symptoms appear during the day for a child, there's lots of even within the government guidance, you've got to have a COVID room. Most schools will have a COVID room, but I suspect with very small children, they're not going to suddenly start putting all the gear on, the masks on, etc., and sit with a child in the room. You know, certainly with you know, early years children, or well, even up to year 6. What's likely to happen, and certainly I can speak for Parkinson Lane, we will be taking the children out into a shelter, sitting with them, albeit a safe distance away, giving them a book to read, etc., and staying with them until their parents arrive.
Brilliant, thank you very much.
And then it'll be all the testing and tracing.
Yeah. Absolutely, thank you. And I can see a question here, Jan, actually, that you might want to answer, that says, if a member of a household is tested positive for COVID-19, will pupils be expected to isolate for 2 weeks as you normally would?
Yes, that's right. So if a child is in a house where somebody's tested positive for COVID-19, then that child would be expected to socially isolate for 2 weeks. The rest of the class wouldn't. They've not been in contact with the rest of the child's household, but that child would be, regardless of whether they got symptoms themselves. Yeah, that's correct.
Brilliant, that's great, thank you. And I can see some questions here actually around around sort of drop off and pick up and staggering school times. So a number of questions actually. So for example, one that says my daughter usually drops our granddaughter off while she goes to work, but she'd need to drop her off 30 minutes before. And I think there's other questions about sort of drop off and pick up, and it might be worth just having a conversation, Gugsy, about what plans you've got for dropping off and picking up children, and how to ensure social distancing during that process.
Yeah, I mean, as I say, we've all got a responsibility, and one of our fears at school is the drop off and pick up, and more than that, it's about parents socially distancing themselves. And certainly, you know, when we did a parent consultation, it was great in terms of coming and picking up the children, that the parents were all socially distanced, but as soon as they got the children, they'd forgotten that there was still this danger, and we're all chatting, and it was a bit of a melee. Yeah. So that's something that we've learned lessons from, and we're hoping that we can make sure that we've got separate exits, etc. We're fortunate that we've got 3 exit entrances into the school grounds, and we'll be utilising most of those for different year groups, albeit slightly different finishing times and starting times for some of the children. And I think most schools have taken precautions like that.
Brilliant, thank you for that. Really helpful. And then I can see another question actually here. I don't know if this is one for you, Lesley. So year 11 children are at a critical time in the studies, and this question is saying they don't feel reassured that they're being given priority, and asking what we're doing to ensure that year 11 children are getting the best possible support.
Yes, I mean it's really understandable that people are concerned about this. You know, a lot of children are at critical points in their educational career, but our year 11 and year 13 students who are at key transition points, where they're taking those qualifications, you know, they've been through such a difficult period with all the anxiety during lockdown, that they knew they were at a critical point. They'd been working very hard towards their exams. And then obviously the lead up to the results coming out, all the anxieties that were around that. And then, you know, it was a debacle, wasn't it, the results time, because our year 13 students got their results, and some of those didn't make sense because of the algorithm that was used. So that's now been amended, but those students are at a critical point and they are a priority. So the schools are working really closely. Since the results have been published, schools have been providing advice and support to students, and they've been doing that in different ways because obviously each school is in a unique set of circumstances, so their building and their approaches and entrances and exits are all very different. So schools take a sensible approach to how to meet with students. So some have had like clinics, drop-in times with appointments. There's been an awful lot of support out there for students. Also, we work obviously really closely with the career service, with C&K Careers, that work with all our schools and provide advice and guidance as well. We've also had support through our Open Minds website and service, which provides emotional health and mental health support for students. And we've been promoting that, schools have been promoting that. And the young people themselves have been heavily involved in that. So I had a meeting this week with the Tough Times Reference Group, and they're doing lots of work to support students and young people. And also then colleges, sixth form provision and universities are obviously very mindful of the impact that this has had on students, and are working really closely to make sure that they support them through those next steps as well. So there's a whole range of things, but certainly I would see that year 11 and year 13 students that are just finishing year 11 and year 13 are key priorities. But Then we have another group of the year 10s going into year 11, and obviously they're at a critical point as well. And schools are working really hard to make sure that their curriculum is right, to address the lost time, to support them with the any changes into the exams for next year, and to make sure that those students are really well prepared and emotionally and mentally, as well as academically, ready for the challenges that they're facing this coming year.
I think it is important to remember that these will be challenges for the young people in Calderdale, and there are services out there that they can access to get that support. Not just year 11s, but obviously we were talking about year 11s then. So they can contact their school nurses, they can contact COOF, and there are other services that are available via the Open Minds website in Calderdale, as well as obviously having support from their families and their schools as well. So I think it's important that this is a challenging time for our young people.
Yeah, I think one of the things that we've got to remember is that education is important right the way through, not just for year 10s and not just those exam year groups. It's vitally important in terms of the social skills, how to learn those basic fundamentals for them to get to where they are to get through the exams. And it's so important to actually get the children back to school for their mental health and well-being, for their social skills, and for learning to take place for the betterment of their future lives as well. Deb, you're back.
I'm back. I'm sorry about the IT. I seem to always have problems. I'm just picking up on the conversation you just have. I can see that there's questions about, why are we keeping schools open in areas of high infection? And I think the points that you've just been making about how important education is to the rest of children's lives. It's really, really important that kids are going back to school. They've missed a lot of school. They've really suffered actually through this pandemic, through loss of school, and even in areas where we've got high levels of infection, it's really important that those kids get the opportunity to learn and to be back in school and socialise and everything. So I think it sounds like you've sort of picked up on that question. I can see there's also questions, and I wonder if this is one for you, Jan, around shielding, around children that were previously on the shielding list, or children where there's someone shielding perhaps in the household. And I can see some questions about that. I don't know if you want to start with that, Jan, and then perhaps some of the others of us can come in on that.
Yeah, so shielding's currently being paused by the government, and before schools were decided that they would be reopened, a lot of paediatric specialists looked at the government's advice and the risk to children, and have advised that it is okay for children to go back to school. However, if you have got concerns, you can talk to your health professionals, you can talk to your school nursing team, your GP, or you can talk to your specialist paediatric if should your child have one of those, and work with your schools to make sure that all the measures that you feel need to be in place, or that you're concerned might not be in place, are in place for your child. The other part of the question was about an adult in the house shielding and the risks for them. Again, likewise, the government has decided, taking scientific and medical advice, to pause shielding at the moment, and I know that people are starting to return to work, those that have shielded, and I think we can only be led by the experts, and the important things are to maintain the social distancing, to wear masks as guided in public places or in places where we are unable to maintain social distancing, and to do the simple things like wash our hands frequently, for 20 seconds, using either soap and running water or hand sanitizer. And if we all take those precautions, we can reduce the risk for all of us and keep families and children in Calderdale safe.
Brilliant, thank you. Does anyone else want to come in on the shielding? Yeah.
Yeah, I think so. The guidance from the government has provided early years providers and schools with further information around that, and it encourages them obviously to discuss those concerns with families. So for children who have been shielding, there is actually a statutory duty on schools to support children with medical needs at any time, regardless of COVID. And that's been in place for some years. So schools will have individual healthcare plans for children who would have been on the shielding list or might be described as clinically extremely vulnerable. And that's routine in education settings. So schools will be reviewing those with parents to make sure that the provisions are in place for the children, and to make sure that any extra considerations that need to be made can be. And where it's a family member, again, the guidance is clear for settings to communicate with those families. Understandably and naturally, those families are going to be anxious about the increased risk to them, and it's very important that there's a dialogue. Early years settings and schools know their families really well and work really hard at the relationship with them, and so it's important to use that in this time and to have a discussion about what the anxieties and concerns are. It's crucial we get children back to school. You know, the Prime Minister has spoken about the moral imperative to have them back. We need children back in school, and the expectation is that all children will be back. But it's important to do that working with parents to address concerns and make sure children are safe.
Brilliant, thank you, Lesley. I can see there's a question around will the council be enforcing fines for non-attendance due to worries surrounding children's health? Again, is that something that, I don't know, anyone want to jump in and answer?
Yes, yeah, I think that's again, the government have made it very clear, and we fully support that high ambition to have all children back in school. That is essential. And so during the lockdown period and up to the end of August, there's those statutory powers around attendance were removed. So it wasn't mandatory for children to be at school, but from the start of this next term it is. And it is important that we have children back at school. However, although those powers are there for fines, the local authority view and working with schools, the approach is that we want to take a supportive approach, not a punitive one. We want to work with families to address those concerns that I just spoke about, to make sure that we build confidence and trust in people to feel safe in early year settings and schools, and to return to that entitlement that all children have for an education. It's not an option, it is an entitlement and a right for all children. So we will be working really closely with schools to make sure that attendance is good. Schools have their procedures in place for that, and we'll have again that relationship with families where they'll work closely. What this can't be is an excuse for children not to attend school unless there's some very valid reason. So that's why there needs to be discussion. I'm not saying that fines will never be used, because sometimes that might be appropriate, but it will be on a case-by-case individual approach. And as I say, we are really saying that fines would be sort of the last resort. What we're looking to do is work with families and work forward in a positive way to get all children back into education and attending well.
I can see that we've actually got quite a few questions actually about social distancing in school. It might be worth just, I don't know, Gugsy, is it worth you just explaining how you're in your school going to apply social distancing, and also perhaps some of the other measures that you're putting in place as well, you know, the hand washing, the other measures that you're putting in place alongside the bubbles and the distancing?
I think we've got to be very realistic, and as head teachers and teachers in school, I think there's an understanding that social distancing is a word that we're going to be using, but in reality, is there actually going to be the social distancing of 2 metres? I'm not sure there is. I don't think classrooms and different schools of different sizes, etc., different classroom makeups, but there are lots of other things, so forward-facing desks, for example, washing your hands regularly. I know all of my teachers have been given sanitizers, so they'll be regularly cleaning, wiping down desks and chairs, etc., to reduce any sort of transmission. Before children go home, before they come in, they'll be asked to wash their hands, sanitize. We've got sanitizer that we intercepted on its way to Nightingale, etc., when it wasn't going to be used. We've surgical wipes. There's a whole host and raft of things that we brought in to try and stop any potential outbreak in school. That's not to say that we can be 100% guaranteed that we'll do that as anywhere, but there is one of the things that we've got to look at is, you know, children coming to school is no different than parents actually going out to work or socialising or going out. Certainly within the community I serve, I've seen children socialising outside, going to the park. The benefit of coming into school is, of course, we've taken extra measures to ensure that the children are safe.
Yeah, and I think it's important that parents and families prepare the children for some of the changes that they might find in school, as Gugsy has just described. You know, possibly one-way systems, the different start and finish times, the additional hand washing, the sanitizers, the additional cleaning that they may see going on. I think it's important that, you know, that parents prepare their children for that, so understand why that's necessary without being alarmist. I think that's really important, so that they have an understanding of what, you know, school might look like, whilst at the same time reassuring them about the things that will still be the same. You know, the uniforms, the teachers, the friends. You know, what will still be the same, giving them that positive message, as well as explaining some of the things that they might expect to be different.
That's a really key point, I think, Jan, that we found that in the wider opening of schools in June, that there is naturally a lot of anxiety. There certainly was when more children started to return to school, and it's getting that balance that schools are a very positive place to be, in early year settings, very positive places for children, where you know, the vast majority of them enjoy being there, and they are actually excited about going back, although we'll have some apprehensions as well. So it's about getting that balance of making sure that children know what to expect, and once they're in, the children who've been back already have found that very quickly they're back in those routines. They understand the new routines. Schools are very good at helping to establish with children those new routines from the very earliest years. So early years providers and early years settings and early years teams in schools are used to working with children of that age and communicating with them at their level so that they understand what's expected. And that's worked really successfully so far. So I think there are lots of things for children to look forward to. And it's about getting that balance right. Gugsy spoke about the sort of system of control that needs to be in place. So social distancing is one part of that. And with the full return to schools, we can't maintain 2 metre social distancing. That's a fact. School buildings are not designed to be able to facilitate that. But that's one part of the system of controls that there will be. So it's that whole sort of hierarchy of things that need to be in place. And the transmission rates for children are higher in the community than they are in schools. The schools that came back, the wider opening in the summer term, the transmission rates were very, very low there because of that system of control that's there. So it's not just about social distancing. It's about a whole raft of things, and it's minimising the risks to children and staff and family members as well. It's everybody that we're protecting. But all those measures together mean that schools are actually as safe as they can be. And as Gugsy said, they can never be 100% safe, but they aren't even when we don't have coronavirus. There's always an element of risks, and professionals are used to managing those risks and making sure that they mitigate and put controls in place so that they reduce the risk as much as possible.
There's been a higher level of risk assessment, hasn't there, in terms of them going off to public health and going off to the council, health and safety. So those risk assessments for the schools have actually been looked over by somebody who's consistently looked at the risk assessments right the way across schools as well. So it's not that one school should be safer than another school. There's been a consistency in approach there.
I can see we've got some questions. I'm sorry, I lost my audio, so I missed what you were saying earlier.
Okay, we seem to have lost Debs again. There's a question here that I can see. Why are full year groups classed as a bubble? This person's got 2 children in different year groups. It's an exposure to 60 children between them, plus teachers and dining staff. Shall I take this one to start off with? The reason that we take a year group as a bubble is because there are certain communal areas where the children will be classed as a bubble. So, for example, if you've got a year 6, they'll be a complete bubble when they go down for dinners, for breaks, etc. And that's why the year group is classed as a bubble rather than the individual classes. We've 3 classes in each year group, and therefore the 3 of them will be using the dining area. Otherwise, the logistics don't work for Parkinson Lane and its buildings. Les, do you want to come in there?
Yeah, I think that's one of the key elements here, that you know, we need to get all children back to school safely, and in early years settings as well. The group sizes are back to normal in early years settings from September, and again, it's that system of controls. It's looking at all the evidence about transmission between children, about the what's happened in learning from other countries and learning from the work that went on in the summer term, and making sure that we can have all children back in full-time education safely. So the bubbles do protect, although they're bigger now than bubbles were in the summer term. It's important still to have those bubbles, because it's about minimising the contact, but it's not limiting it and keeping children to just a very small group, because that's not what happens out of school either. As somebody mentioned earlier, children will have contact with other people out of school, as will other family members. But it's about having those controls in place to limit the mixing between the bubbles. And where there are siblings, then it wouldn't work for them to be in the same bubble at school, because we're looking at education. This isn't in schools, this isn't about childcare. Now we're talking about getting back to making sure we've got, you know, formal learning going on, so that those children are making really good progress and catching up on some of the lost time that they've had. And for that, teachers need to be able to work professionally in the way that they do, working from children's starting points and using the curriculum. To do that, they need to be in their classes. That's how children will learn well. So I think, you know, I can understand parents' concerns. They seem big numbers, but all those measures are in place to protect them and to minimise the contact between the groups. To do things like cleaning, as different bubbles move from using equipment outside or in PE or at lunchtime. It allows for that, and schools are all well prepared to do that.
And if something happens where there is an outbreak in a bubble, because there's not the cross-contamination vis-a-vis different bubbles, it allows us to isolate the bubble that's perhaps infected and still keep schools running for the betterment of other children's education.
Can I ask, I can see a few questions about face coverings. Can I ask, because I lost my audio before, we haven't covered that, have we, just to make sure? No, brilliant. So there's a few questions I can see. I think there's a question about children in childcare, early years settings, wearing face coverings. And I think it's really clear actually in the guidance that children 3 and under should not be wearing face coverings at all. They absolutely should not be wearing them. I think we would, we don't recommend that children at primary age wear face coverings either. There's for a lot of reasons for that in terms of child development and needing to see facial expressions and people to language development, and then obviously in secondary school. Again, my understanding of the guidance is that we don't recommend in secondary school face coverings are worn in lessons, but actually we do recommend. From a public health perspective, where it's difficult to socially distance in secondary schools, like for example in corridors, that the school might want to ask the children to wear face coverings to reduce the likelihood of spread at those times. That's my understanding. I don't know if anyone else wants to comment. There's another question as well around face coverings. The school having a supply of them, secondary schools having a supply of them, if that's useful for children, perhaps whose families can't afford to buy face coverings. So I don't know if anyone else wants to come in on face coverings.
Yeah, so you're right about secondary schools, that face coverings are recommended, in public for children 11 and over. And what the government said a few days ago about schools, secondary schools, children aged 12 and above, so those are over 11, that while in the areas, including Calderdale, where there is a local lockdown, that schools, secondary schools should have masks, face coverings in public areas, as you said, corridors. But for schools secondary schools where we're not in local lockdown, that the schools have got that flexibility to make their own decisions and judgments about that. And I assume that those schools in those areas would do that and consult and inform and let parents know what their decisions were about that. My understanding about masks, where families may not be able to afford masks, is that schools would be able to support them with that. That's my reading, and that's what we would definitely encourage. Lesley, sorry, I can see you want to say something.
No, I was just going to come in. I think some guidance came out this week that's for schools and other educational settings with children who are year 7 or above. So that includes obviously colleges as well. And the guidance is that it's up to schools, other than where there are local restrictions, which obviously Calderdale is subject to at the moment. So students in year 7 and above in educational settings will be asked to wear face coverings in those communal areas, so corridors, moving around. But not in classrooms, and as Debs said, that the guidance is very clear that masks, face coverings don't need to be worn in classrooms because they can impede teaching and learning. And certainly for younger children, the guidance is very clear that they don't need to be worn and shouldn't be worn because it will interfere with their learning. And it's about, again, that balance of keeping children safe. We're going with the scientific guidance that we're getting, and we're working closely with colleagues in public health. And I think schools would certainly discuss with public health if they had any specific questions, particularly in those areas where there are high rates of transmission. But the guidance is also clear about transport, that children will need to wear face coverings when they're on either dedicated school transport or public transport. But there are some exceptions to that. So there will be some people who can't wear masks for either for mental health reasons or physical impairments, or a whole raft of reasons why people may be exempt from wearing a mask. And people won't be asked to provide any medical evidence for that. Again, it will be in discussion, and we're very keen to make sure, and schools will be working really hard to make sure that people aren't stigmatised either for wearing a mask or for not wearing a mask or a face covering. So there'll be an awful lot of work going on. Schools will be asked to hold a small contingency of face coverings, because there will be times where perhaps one will get damaged or lost. The guidance from the government is clear aware that they expect that people have face coverings now because they're being used in wider society. But we recognise that actually this does have implications for many families, that there is a cost involved in this. And I know that Public Health are going to be working to produce some support, and also coming from the national government, we've had some information through about how face coverings can be made, and that's something that schools will be looking at, because that can also be part of a curriculum activity that explores why face coverings are important, and helps all students to have one.
Great, fantastic. Gugsy, I can see a question here about school dining. I don't know if you've seen that one about dining, school dining. Yeah.
Just to go back to the last one, can I suggest that, because I presume there'll be lots of parents watching this. I think what communication is going to be key, and I think it's really, really important, whether it's about maths or anything to do with COVID, that and anything that you're unsure about and you want answering, rather than not talk about it, to give the school a ring and just say, look, could you just explain this to me? And I'm sure schools will try their best to allay any fears that parents have got. Just to come on to the dining room one then. Yes, lots of children going through dining rooms. How are we going to make sure that that children are kept safe? Certainly here at Parkinson Lane, one of the things that we've done is we've split the dining area into 2 areas for different year groups. And then what will be happening is that there'll be a full clean down before another sitting takes place, with antibacterial wipes and sanitizers and that side of things. So yes, there's a full wipe down, and we've altered the dinner times to be able to accommodate that as well.
Brilliant, thank you. I can see a question around what constitutes an outbreak, and also one around testing, if you don't mind me just answering that, those questions. In terms of what constitutes an outbreak, we think of an outbreak when there's more than one case of virus, the coronavirus, in a setting where there's a link between the 2 cases. The system that we have in Calderdale is that every time that there's a case in a school, so if a child or a staff member tests positive for coronavirus, we'll be informed in our local public health team, and Public Health England will be informed. And then what we'll do is we'll take action really quickly to either close down the bubble, ask the contact, identify whether there's been contacts within what we call the infectious period, and we'll identify if anybody else within the school has been in contact. If they've been in contact, then we'll investigate further. And we'll take action to contain any further spread of the virus. One of the things that's been asked, I think someone's asked about assurance that we're not going to be routinely testing primary school children. We won't be routinely testing children at all. The only time that we'll be suggesting that children get tested will be if they have symptoms. And that's something that we will suggest to parents and encourage parents that have got children that have got symptoms of the virus to get tested. But we absolutely will not be routinely asking children to be tested for the virus. And we do know that there's, children might be less likely to have symptoms, but it's really important that it's a parents decide if the children are going to be tested for the virus. That's really, really important. I think I'm just scrolling down for another question. I think I'd seen a question that I wondered if Jan would answer, which related to if a child, for example, has got asthma or another respiratory disease, and usually the school help with use of inhalers, will that continue? How will that work when children go back? I don't know, Jan, if you can answer that question.
Yeah, so if we're talking about asthma, I think it's really important that children have their annual check, and we may have found over the last few months that some children have missed out on that opportunity. So I know that Asthma UK is really keen for children with asthma to have that annual check, and so please contact your GP to have that arranged. And then your school nurse can support you with your following your annual check with the plan that comes out of that, to make sure that's implemented in school through working with the school to make sure that your child's safe, and that the use of the inhalers does continue, because that's really important. And often at this time of year, we do find that children, while they've been on the summer holidays, have maybe not used particularly their preventative inhalers in a routine like they would have done previously as prescribed. So really a plea to all parents to make sure that their children do get back into using their preventative inhalers if that has lapsed during the school holidays, ready for school, to protect them and to ensure that their asthma is well controlled. But yes, schools will definitely be supporting children, as Lesley said earlier, with their ongoing health needs. Yeah.
Brilliant, thank you. And I can see a question as well, probably actually for all of you, around what support's going to be put in place to support children's emotional well-being after such a long period at home. It's going to be a big adjustment for children. I don't know who wants to start with that one. Gugsy, do you want to start with answering that question?
I think it's a great question, that one. And something that we've already been addressing while the children have been off. So there's been regular calls to the children at home, and certainly my staff have been ringing the children, the parents, at least once a week. We then further enhance that by having a consultation with their parents, where the children came in with the parents and had a couple of 20-minute consultations with parents in terms of what they were doing for their work and how they were feeling about things and any anxieties that they might have. And then we took it another step further, and we invited the children in for the afternoon and sat down. Now, it was really interesting. When the children came in, all they wanted to do was to talk to each other. They weren't really interested in any of the activities. In fact, one of the girls said, can we sit down and talk for a long time? And that was really interesting, because they obviously wanted to talk about their experiences, etc. And I think schools are going to have to adjust and give children that freedom and time to sort of feel their way back into school, and to do some circle time, and to do, maybe exploring feelings, maybe to explore perhaps they've lost loved ones or know of loved ones that have been lost. So really to go into that mental health side of things, and to know that actually that they're in a supportive environment as well, where we can all come together and help.
Jan, do you want to add anything to this?
Yeah, I think parents as well can support their children in preparing to go back to school by spending some time talking to them, asking them questions about, what are you worried about anything? Have you got any anxieties? But also asking them what they're looking forward to, and explaining that it's normal to have that mixture of feelings, excitement, like as Gugsy said, to see their friends again and spend time talking to their friends for a long time, as the little girl said, but also to talk about those worries and anxieties. And the older children who may have been watching the news and social media and getting mixed messages, to unpick those mixed messages. But there is support out there for children and young people, and for the parents, as well as the schools. There's school nursing services, there's health visiting, there's, as I mentioned earlier, there's lots of services listed on the Open Minds website, and there are anonymous services that you can use, like Couth, to text and chat health through the school nursing to get that advice if that's what young people, older people and parents want. So there is the support there, and everybody in Calderdale is working together to make sure that support for young people and children's well-being is available to them.
Brilliant, thanks, Jan. I can see that there's a lot of questions I understand about cleaning, so I'm going to ask. I understand questions around the cleaning measures that are being put in place in schools. I know, Gugsy, you mentioned earlier about cleaning at lunchtime. Is there anything else you want to share around the sort of cleaning regimes that are going to be in place in schools? Perhaps Gugsy and then Lesley, maybe.
In terms of my staff have been incredible, and they've taken on board the fact that there's wipes in every classroom, there's sprays in every classroom that the children, and what they're doing is they've got a very good regime of certainly wiping down the whole lot within after every hour. And every classroom's got that. We've sanitizers at all the entrances and exits. All the corridors, are either on fire latches, so the doors are open, or they're all being wiped down regularly as well. Toilets are all being regularly wiped down and cleaned. So I think that we've got lots of measures in place in terms of cleaning. Our cleaners at school are absolutely fabulous. They come in on a morning and an evening and make sure they do a deeper clean. In terms of our early years, our nursery staff, they're actually going to shut on a Wednesday to do a full deep clean, because we run a Monday, Tuesday and a Thursday, Friday. So the Wednesday is going to be dedicated to cleaning all, the tables, etc. But also, I think what's really important is looking at break times, any equipment that's used by different bubbles. That's all going to be cleaned down and made sure that that's safe for the next group to use. PE equipment, where PE is taking place, that's also going to be wiped down. Books that are being taken home, etc., will be in a sort of quarantine for 3 days before they're handed out to the groups, so there's not the sort of cross contamination. And lots of staff, lots of the children working together to make sure that we're keeping everybody safe.
And I can see a couple of other questions that are popular, if that's all right. I'm conscious of the time, and we do want to answer as many popular questions as possible. There's two that I can see that seem to be popular. One is around taking masks on and off, about being provided with bags, and also guidance about the safe putting on and removal of masks. I don't know if anyone wants to answer that. And then I can see another one around dropping off and picking different family members, dropping off and picking up children. So if we do the masks one, do the dropping off one, and then do a bit of a roundup, if that's okay with everybody.
Yeah, in terms of the masks, Debs, schools will be, just as they're doing with all the other new routines that children are getting used to, and children do get used to those very quickly. They'll be educating and teaching children what they need to do with that, but we also again need the support of parents with this, that the advice is clearly out there about how to use masks. We should all be following that, because we're all using masks when we're out and about. So it is important that children understand how to use them safely, and they should have a plastic bag to store them in. That'll be very important, but schools will be doing a lot of work to support children in how to use those properly, because that's a fundamental part of having a face covering, is that they're used properly and children aren't touching them and they're not using them if they get wet and things like that. So, and in terms of the dropping off and picking up, different family members can drop off and pick up. Schools will have measures in place outside of schools, as Gugsy said earlier. That's crucial, that we need parents to be role models here, to be showing children what's expected and to be following the guidelines themselves. People will need to get back to some sort of normality with their routines of dropping off and picking up. And each school will have different procedures for that, because every building and site is completely different. So the advice is to talk to the setting, the early years setting and the school about what the measures are there. If you're not sure what those are, check with the school or setting what's expected of you as parents and family members who are dropping off.
And then finally, there's a question about staff wearing face coverings. I don't know, Gugsy, if you want to answer that one from a perspective of a head teacher.
I mean, really, for me, I think it comes down to the individual. I have no real strong opinions on staff wearing face coverings, but I certainly think when they're teaching, it's very important to see the formation of words, etc. And so for me, it comes down to what the individual wants. But certainly, I'm happy for staff to come and chat to me and say, look, I want to wear a face covering whilst I'm on break duty or what, you know, etc. etc. And you know, certainly we'll be looking at some sort of flexibility there. But I wouldn't necessarily be advising the use of them in class whilst they're teaching. And just very quickly on that, we did have some children come in with face coverings, and that was very difficult with young children because they kept touching them, they kept adjusting them. Some of them took them off and then picked them up, and we were saying, no, that's not yours, you know, that's somebody else's, and you know, so that does become very difficult for certainly for teachers to manage with very, very young children. And I think they're probably going to be safer without them than they are going to be with them because of all the reasons that I've just cited.
Great, fantastic. Well, I think we're coming to an end. I'm just going to ask you if there's just sort of one more thing each of you would like to say to sort of reassure parents that you know, about children going back to school. I'm going to start with you, Jan. Is there anything else you'd like to say just to finally?
I'd just like to say that I hope that everybody feels reassured listening to this, that we are all working together to do our best for the children and families in Calderdale to keep everybody safe. And, you know, we are responding very quickly to national guidance and making sure that, you know, we do keep children and families safe in Calderdale. And I hope that we've offered some reassurance, and that if anybody does need extra support from, you know, any of the services here, but obviously the services that I line manage, the health visitors and school nurses, please, you know, don't hesitate to get in touch, you know, to ask those questions. We're there, you know, to support you.
Gugsy, anything finally from you?
Just in terms of teachers and head teachers and certainly school communities, most of us came into this profession, if not all of us came into this profession, to help children, to help communities, etc. Schools have been horrible places without the children and without the parents. And for me, I'm really excited to welcome back my community and seeing children coming to school and the laughter, etc. It's like somebody's pulled the soul out of school. I used to say that I could run a fantastic school without children. Never again will I say that, because it's the children, it's the parents that actually bring the soul to school. So I'm really looking forward, you know, to seeing the staff regularly, to seeing the parents regularly, seeing the children. So I can't wait for schools to start and to see everybody get back to some normality.
Leslie.
Yeah, I mean, I'd echo what Janet and Gugsy have said there, that we all want the same thing. We all, you know, are committed to getting children back to their early years settings and to schools as safely as possible. It's not in anybody's interest for children to be at risk, and we do need them back in school. They've missed education now for too long. You know, we don't want to miss a day of education normally. We work so hard to keep children in school, and that everybody's working to the same end. And I think that the key message through all this is communication, that if people do have questions or concerns, to speak to their school or their early years setting and to ask the question, to seek reassurance, to explain what their concerns are, because people will be wanting to make sure we get this right. Nobody's going to be taking any undue risks. Schools and settings have worked so hard to get all the procedures in place and all the new routines sorted. So, you know, I'm confident it's going to go well. The children and staff and parents I've spoken to are excited about being back. There are obviously apprehensions, but I have some family members who are going back to school or back into childcare settings, and they are so excited, and I'm excited for them and have confidence that it's going to go well for them.
Great. Well, thank you, everybody. Thanks to the panel, and thanks very much for joining us this evening. Thank you very much. Bye.
Thank you. Bye.